The treatment of parasites depends on the specific type of parasite and the infection it causes. Here are some general guidelines on how to treat parasites. Diagnosis. The first step in treating a parasitic infection is to accurately diagnose the type of parasite involved. This is typically done through stool, blood, or tissue sample tests conducted by a healthcare professional. Medications. Once the parasite is identified, your healthcare provider will prescribe appropriate medications to target and eliminate the parasite. The type of medication and the duration of treatment will vary depending on the specific parasite. Common antiparasitic medications include antiprotozoal drugs. These drugs are used to treat infections caused by protozoa, such as Giardia, Entamoeba histolytica, and Plasmodium, malaria. Examples include metronidazole, chloroquine, and atovaquone, proguanil. Anthelmintic drugs. These drugs are used to treat infections caused by helminths, worms, including roundworms, tapeworms, and flukes. Examples include albendazole, mebendazole, and praziquantel. Antifungal medications. Fungal infections can also be parasitic in nature, and antifungal drugs like fluconazole and amphotericin B may be used to treat them. Follow the prescription. It is crucial to take the prescribed medications exactly as directed by your healthcare provider. Completing the full course of treatment is essential to ensure the complete eradication of the parasite. Hygiene and preventive measures. Preventing further exposure to the parasite and maintaining good hygiene practices is essential. This may include washing hands thoroughly with soap and clean water before eating and after using the restroom. Avoiding consumption of contaminated food and water. Cooking meat and seafood thoroughly to kill potential parasites. Practicing safe sex and using condoms to prevent the transmission of sexually transmitted parasites. Avoiding contact with infected individuals, especially in crowded or unsanitary conditions. Environmental control. For some parasitic infections, it may be necessary to control or eliminate the source of the parasites in the environment, such as treating contaminated water sources or improving sanitation. Monitoring and follow-up. Your healthcare provider will likely recommend follow-up tests to confirm the successful treatment of the parasitic infection. It's important to attend these follow-up appointments. Supportive care. In some cases, you may need supportive care to manage symptoms, such as rehydration for diarrhea caused by certain parasites. It's important to note that the treatment of parasites should be supervised by a qualified healthcare professional, as the choice of medication and treatment regimen will depend on the specific parasite and individual health factors. Self-diagnosis and self-medication are not recommended, as they can lead to ineffective treatment or complications. If you suspect a parasitic infection, consult a healthcare provider for proper evaluation and treatment. Treating parasites generally involves a specific approach depending on the type of parasite. Here's how you can treat some common parasitic infections. Protozoan infections, e.g., Giardia, Entamoeba histolytica, trichomonas. Prescription medications. Protozoan infections are typically treated with antiprotozoal drugs. Your doctor will prescribe medications such as metronidazole, tinidazole, or nitazoxanide. Take medication as prescribed. It's important to take the prescribed medication as directed by your healthcare provider and complete the full course of treatment to ensure the parasite is completely eradicated. Helminth infections, e.g., roundworms, tapeworms, flukes. Prescription anthelmintic medications. These infections are treated with anthelmintic drugs, which are specific to the type of worm. Common medications include albendazole, mebendazole, praziquantel, and ivermectin. Deworming protocol. The treatment may involve multiple doses to eliminate different stages of the parasite's life cycle. Malaria, caused by the Plasmodium parasite. Antimalarial medications. Malaria is treated with antimalarial drugs such as chloroquine, artemisinin-based combination therapies, ACTs, and others, depending on the region and the resistance pattern of the parasite. Preventive measures. In addition to treatment, preventive measures such as bed nets and antimalarial prophylaxis may be recommended. Topical treatments. Scabies and lice are often treated with specific creams or lotions containing medications like permethrin or malathion. These should be applied to the affected areas and left on for the recommended duration before washing off. Wash and clean. It's important to wash and clean all clothing, bedding, and personal items to prevent reinfestation. Anthelmintic medications. In the case of tapeworm infections, a single dose of praziquantel is often effective. Your healthcare provider will determine the appropriate dosage. Hygiene and preventive measures. Hand hygiene. Good hand hygiene, including washing hands thoroughly with soap and water before eating or preparing food and after using the restroom, can prevent many parasitic infections. Water and food safety. Avoid consuming contaminated food and water. Cooking food thoroughly can kill potential parasites. Safe sex. Practicing safe sex and using condoms can help prevent sexually transmitted parasites. For some parasitic infections, it may be necessary to control or eliminate the source of the parasites in the environment, such as treating contaminated water sources or improving sanitation. Your healthcare provider may recommend follow-up tests to confirm successful treatment and ensure the infection has been completely cleared. It's crucial to consult a healthcare professional for the diagnosis and treatment of parasitic infections. They will prescribe the appropriate medications and treatment plan based on the specific parasite and individual health considerations. Self-diagnosis and self-medication are not recommended, as they can lead to ineffective treatment and potential complications.